race is on for a COVID-19 vaccine. Moderna has applied for FDA emergency use authorization. It is now the second drug maker to make that move. If approved, Moderna's vaccine could be available for Americans by December 21st. Moderna says its vaccine is more than 94% effective. It expects to have roughly 20 million doses of its vaccine available in the U.S. by the end of 2020. Good afternoon, everyone. I'm Kelly Eckerman. Now that we are getting closer to a vaccine, there have been questions about who will get it first. KMBC 9's Michael Mahoney breaks it down for our area.
Healthcare workers on the front lines and in long-term care facilities or with health risks of their own will be first in the vaccination line. Both states say there is a strong likelihood of limited vaccine availability in the first phase. In the past, cost has been a factor for some in vaccinations.
It's free, so we can take cost off the page. If you want a vaccine in Missouri, you'll be able to get it for free.
Same in Kansas. People 65 and older will also be high on the vaccination list, along with other high-risk categories. Kansas also has a provision for its tribal nations. A Missouri goal is reducing stress on the healthcare system and accelerating the economic recovery. The second tier in both states will include first responders and other workers who cannot do their jobs from home. In Missouri, that includes teachers and school staff. Missouri will be storing its supplies in Kansas City and St. Louis at first. Both states plan on mobile clinics to get to hard-to-reach areas. And the final phase will be to vaccinate anybody who wants a shot. But the first goal, get to as many frontline healthcare workers as possible. Now, if the vaccines are approved by the federal government sometime in December, some healthcare workers in Kansas and Missouri should be first in line. Michael Mahoney, KMBC 9 News.
Now, both states say there could be changes in their plans once they know more details about the vaccination distribution. CVS and Walgreens are preparing to be among the first companies in the U.S. to give the vaccine. Those vaccinations would take place in long-term care facilities, not in retail stores. A CVS spokesperson says they expect to be giving vaccine shots at long-term care facilities in mid-December. Walgreens expects to start within days of receiving the vaccine. New cases in Kansas and Missouri are going down. In Missouri, the 7-day rolling average is down to 3,300. In Kansas, the number of new cases is down from Friday to 4,400. In Kansas, the monthly positivity rate is down to 18.4%. In Missouri, the positivity rate remains steady at 20%. Well, despite warnings from health experts, many families did decide to gather for the Thanksgiving holiday, and that has some local health experts concerned moving forward. Doctors with the University of Kansas Health System say it's too early to track a rise in cases, but they're going to be keeping a close eye on the numbers starting in about a week and a half when they expect to see signs of potential infections because of Thanksgiving celebrations.
We know that people have gone through Thanksgiving now. They probably want to see friends again from that time until Christmas or even after Christmas. And so I think we are really heading for further infections, but we won't know for that 10 to 14 days, from now or from Thanksgiving.
Other metro area hospitals are also concerned about a rise in COVID-19 hospitalizations following the holiday weekend. KMBC 9's Emily Hallwick spoke with the head of the COVID-19 response team at St. Luke's, and she joins us live now with what the hospital is seeing right now. Emily?
Well, there were 108 new COVID-19 hospitalizations across the entire Kansas City metro yesterday, and that is down from what we've been seeing in recent weeks. But doctors here at St. Luke's are concerned that a post-Thanksgiving spike is imminent. So first, let's take a look at some of the latest numbers here. The average number of daily new hospitalizations in the metro has gone down over the last 10 days from 190 on November 20th to 146 today. ICU bed availability has increased in the metro the last 10 days from 88 beds open November 20th to 121 beds open yesterday. Now, here at St. Luke's, COVID-19 hospitalizations have remained high. Dr. Mark Larson tells me they have 190 COVID patients in their health system right now, which is still close to the highest level they've seen. He said over the weekend he saw many patients come to the ER with COVID symptoms who had been at Thanksgiving gatherings. He recommends that anyone who is with others over the holiday act like you could be infected and stay home.
Really, the biggest thing is that to treat yourself as if you were exposed over the holidays, and just please stay inside. The next 2 weeks is going to be crucial as we face probably our biggest challenge of this pandemic from a staffing and a hospitalization standpoint.
Dr. Larson said if you did get tested over the weekend and tested negative, don't assume you're in the clear, especially if you have symptoms. You should get tested again to make sure. Reporting live in Kansas City, Missouri, Emily Hallwick, KMBC 9 News.
And St. Luke's will continue to work with the contracting agencies to address staffing needs as cases continue to rise. Now, the spikes could come after Sunday became the busiest day for air travel since the pandemic started. According to TSA, nearly 1.2 million people passed through airport security Sunday. It was still just 41% of the number of people screened by TSA on the same day last year. The CDC advised against Thanksgiving travel, fearing family gatherings would spread the virus.